Good afternoon, ladies and gentlemen. Welcome to Farsi ASWB Prep. We are back today, December 30th, 2023, for another review on how to answer the questions using the safety feelings assessment, refer, educate, advocate, facilitate, and intervene method. I might go back and forth between that method and just using other method of knowing who you are, where you are, the stages of intervention, from intake to assessment to intervention, treatment, and evaluate, so on and so forth. So for the first question, before I get started, I want to say there's a disclaimer. I did not create these questions. I'm only using them to show people how to answer the questions on the ASWB exam. These questions are being used only for educational purposes. All right, so we can get started. I'm doing 3 questions today. All right. Don't forget to hit that like and subscribe button and share the channel. Thank you for your support. So the first question we're going to do today, social worker in private practice is meeting with a client for an intake. The client states that she is depressed, feels that she's alone in the world. What should the social worker do next? So before we dive further into the question, so just knowing where you at as a social worker, knowing what stage you are with the client, and then what they're asking you to do, or what they're coming in with the presenting problem, and then what they're asking you to do. Okay. And then remember that next, first, best, they all means similar things. They're not different from each other. They are similar. Okay. So we're going to read the question again. So social worker in private practice is meeting with a client for intake. The client states she's depressed, and feel free to pause the video at any time and select an answer, and then we'll reveal the answer after the question and the strategy, and then you see if you got the question correct. Okay. The client states that she is depressed and feels that she's alone, or what should the social worker do next in this situation? So we're going to go over the answer choices. A, tell the client that she's not alone and point out the support she does have. B, acknowledge the client's feelings of depression and loneliness. C, continue to collect information needed for the biopsychosocial evaluation. And then D, create a safety plan to ensure the client's safety. So the way we're going to attack the answer choices is that we're going to pick the answer choice that does not fit, and we're going to exit out and give a reason why until we arrive upon the right answer. All right. The first thing, and then also, just a side note, so this strategy I'm using, it might not work for every question. So just be cognizant of what question you're using it on. So, all right. So the first answer choice we are going to eliminate will be D. Create a safety plan to ensure the client's safety. Well, in this case, that would be safety, but we cannot create a safety plan because the client did not state that she wants to kill herself. All she stated was that she was depressed and felt alone in the world. So D is not our answer choice. Okay. C, go to C. Continue to collect information needed for the biopsychosocial evaluation. Well, we could do that, but that would be necessary because we're doing an intake, and basically a client states to you that they feel depressed and feel alone in the world. You're not just going to continue to collect biopsychosocial from the client. You want to build rapport. So that would not be something we do in that movement. Okay. So not to like that answer choice. So C is wrong. All right. We're going to go to A. Tell the client that she's not alone and point out the support she does have. Well, we don't know this client. We just met her today. She's coming in for intake, which you're doing, insurance paperwork. You're letting her know about consent and confidentiality. So you're not going to tell her, oh, you're not alone. You have all these supports. You don't know all the support she has. So, and another thing is the client is the best teller of their own story, right? They're the best to tell their own stories. So we can't jump the gun and say, oh, you're fine. And, we can't do that. So we're jumping the gun. That's intervening. That will not work. All right. So after going through all that part, all that, the first three answer choices, we have arrived to the last answer choice, which is B, acknowledge the client feelings of depression and loneliness. You would do that, and then we'll keep on taking biopsychosocial information for the insurance and then move on forward. So that's the first thing you do. You're trying to build rapport with the client at intake. So you're not going to continue to collect information needed for biopsychosocial evaluation when you're doing intake and the person state to you, oh, I feel depressed and I feel alone in the world. Just not sensitive, So acknowledging the client feelings of depression and loneliness would be the best answer choice, which is feelings. All right, let's go to the next question. And as you can see, using this strategy, feelings is above. So this client may appear as safety, but it's not safety in this situation. That's why I said sometimes this strategy doesn't work for all the questions. But it's not safety in this situation because she said nothing about killing herself. She said she's depressed and feels like she's alone in the world. So safety wouldn't matter in this case. Continue to collect information needed for biopsychosocial. That's assessment. So assessment wouldn't work in this situation because right now they're asking you right now, she feels depressed. She's in front of you. She's meeting you for the first time. What are you going to say to her? So continuing assessment is not going to be it won't be a sensitive part from the therapist or the social worker to just ignore the client's feelings and continue to collect information from the client. So that would not work. And then A is intervene, which is the last on the list. It's the last thing you do, So we're not going to do that. So feelings will be the best answer. As you can see on this hierarchy of things, feelings comes in second, which trumps everything else. And since the question doesn't have anything that deals with safety in it, so safety is ignored in this case. So the best answer choice would be B. And I'll highlight that so you know it. Okay. We're going to go to the next question. You're working in a foster care agency, a potential foster care family. The family would be fostering a newborn who was exposed to drug and alcohol in utero. Families asked the social worker what this would mean for the baby. What would be the best response the social worker to give the family? So we're gonna again remember we are figuring out where we at. So we have a foster care agency, working on a family to adopt a newborn who was exposed to drug and alcohol in utero. The family asks the social worker what would that mean for the baby, and then what would be the best response. Best to me, what's the most ethical response you can give? I'll jump into conclusions. To a family who wants to adopt a baby that's drug and alcohol, and it's a big moment for them. So A, show the family with support and caregiving. They can reverse the effects of exposure with love and nurture. B, ask the family if knowing this background on the baby changes the decision on fostering. C, provide a potential effects of drugs, alcohol exposure for newborns. Let the family know. Supports and resources will be provided if needed. D, suggest that the family join a support group for fostering parents of newborns. So we're going to eliminate the first question. We're going to eliminate D because it's something we'll do along the lines. We're not going to do that right now. This right now is not the appropriate time to facilitate. We're not going to do that. We're not going to refer the family or facilitate them going to a group. Not something we're going to do. That's just not appropriate for this situation. We'll do it along the lines later on, but right now in this situation, in this room, they're in front of you, they're asking you what it would mean for the baby, suggesting them to join a group support. It's kind of like ignoring the question they're asking you. That doesn't help to answer the question. It's not an appropriate response. C, provide information on the potential side effects of drugs and alcohol exposure for newborn, and let the family know supports and resources will be provided. Proper potential answer. B, ask if knowing this background, the baby changes the decision on fostering. It's a totally inappropriate question. You're doing an assessment. They're asking a question about the condition of the baby. They're not asking you. They're not telling you they want to change their mind. They know that the baby has alcohol abuse in utero, and that they're willing to adapt, but they didn't mention anything about changing their minds because the baby has alcohol abuse or drug abuse in utero. So we're not gonna select this. B is wrong. And then we'll go to A and show the family that with their support and caregiving, they can reverse the effects of exposure with love and nurture. We are not medical experts. We are not going to tell them that they can change the effects of drug and alcohol by just loving the baby, showing care. We're not medical experts. That's not our scope of practice. We're not going to do that. That is intervening. Okay? Intervening. This is assessing. Assessing is inappropriate for this situation. And D, suggest the family join a support group for foster parents of newborn. That is facilitate. We're not going to do that. And then C, it's the last answer choice left. Says provide information on the potential side effects of drug and alcohol exposure for newborns, and let the family know support and resources will be provided if needed. In this situation, this is the correct answer because we are going to educate. They do not know what it takes to take care of drug and alcohol abuse, baby, newborn. So we're just going to provide information on potential side effects and alcohol exposure for newborn because that's what they're asking. What does that mean for the baby? And so we have to let them know what symptoms they might see. So we just provide information to them and then let them know that if they need any support, we will provide the support if needed. So that is the best option, will be to educate. So in this hierarchy, we educate and out of our scope of practice. We're never going to ask that question. Never going to make a statement like that. That's medical. So we're going to go to number 3, the last question. Number 3, you're working in a mental health agency, with a 26-year-old female. You've been working with this client for 5 months. The client was provided antidepressant from her doctor 3 weeks prior. During a weekly session, the client states that she feels her antidepressant makes her tired and out of it. She states that she will stop taking the medication due to the side effects. How should a social worker respond? So looking for ethical response, appropriate response here. So in this case, we are working in a mental health agency with a 26-year-old female. She's working with you for a while, so this is not the intake. This is an intervention stage. You are actively working with her in 5 months now, and then she comes and tells you, "Oh, I've been taking this antidepressant, and it makes me tired, and I'm out of it." So encourage the client to speak with her doctor before stopping medication. A, educate the client on the proper use of medication. B, explain to the client that symptoms may be due to depression and not the medication. D, ask the client to bring the medication to the next appointment so you can further assess. We are going to eliminate D, ask the client to bring the medication to the next appointment so you can further assess. We're not doing no assessment. That right there is out of our scope of practice. C, explain to the client that the symptoms may be due to depression and not the medication. It may be due to depression, But we also do not know. We are not going to educate the client. That's intervening. We are intervening. We're not going to educate the client on the medication, out of scope of practice. And then educate the client on the proper use of medication. We're not going to do that also. That is educate. That's out of the scope of practice. Encourage the client to speak with her doctor before stopping the medication. That's exactly what we're going to do. We're going to encourage the client to speak to a doctor before stopping the medication. So in this case, we're going to refer her to a doctor before stopping taking the medication. The doctor will give her the best advice on medication because it is out of our scope of practice. We're not going to do that. All right, that is it. Thanks for watching. I'll catch you guys in the next video. Please don't forget to hit the like, subscribe, and share the video. Good luck on your exams.